Good afternoon, everybody. Thank you, Francis, for that introduction. Wow. Hopefully more people are already on their way from lunch because in this session, we will be nourishing our minds, not our stomachs, with hopefully exciting, important, and urgent ideas. Because in this session, we will be talking about some of the most pressing challenges that our planet and its people are currently facing. Again, I'm Renzo Guinto. As mentioned, I'm from the National University of Singapore. I'm from the Philippines. I'm also affiliated with the St. Luke's Medical Center there. I also am advising the Philippines Climate Change Commission, which is our governing body in the country when it comes to climate science and policy. I also chair the Philippine Medical Association's Committee on Environmental Health and Ecology. And at the international level, I chair the thematic working group on climate resilient and sustainable health systems at Health Systems Global, and I'm also a member of the Lancet Commission on Sustainable Healthcare. I just mentioned those several affiliations to highlight that climate and health is really now at the top of the health agenda, both at the international level as well as at the national level, in many different countries around the world. Climate change is not an issue for tomorrow. It's already happening as we speak. I'm sure you've seen in the news that, whether it's Bangkok or Manila or Singapore or, any other Southeast Asian city, over the past several weeks, we've been experiencing a massive heat wave that is unprecedented in our modern history. And some say, climate scientists are saying, this is just a sneak preview of what is yet to come in an era of an unstable climate. So climate change is really now a priority that I'm happy that the International Society for Priority Setting in Health is now giving attention to. Climate and health are deeply interlinked. The WHO estimated a few years ago that there will be around 250,000 deaths annually that will be generated by climate-related health conditions. I think that is a huge underestimate, and for sure now the scientists and the epidemiologists and the modelers are trying to refine that number, especially when we hear in the news that I think a few weeks ago, the UN climate chief said that we only have 2 years remaining to stabilize the global climate system. Another group of scientists said that we only have until 2027 to make sure that we keep the global average temperature increase below 1.5 degrees Celsius, which is written in the Paris Agreement that was signed by countries in 2015. So these are just some of the not so positive, news developments when it comes to, climate change and its intersection with health. Every disease condition, every disease group is going to be affected by climate change. I always say to the young doctors, regardless of your clinical specialty, you do have an important role to play in tackling climate change and its health effects. It will certainly disrupt our health systems. It will affect our progress when it comes to achieving universal health coverage. It will also exacerbate persistent health inequalities within and between countries. But also it's important to remember that the health sector is not only an impact-receiving sector, we're also contributing, unfortunately, to the climate crime. There are reports saying that around 5% of the global greenhouse gas emissions attributable to the global health sector. And in some countries, it's up to 10%. And, we now also need to do our part in order to reduce our ecological footprint, in order to make sure we achieve our global climate goals, our ambitions. And in the recently concluded COP28 that was held in Dubai in December, after 27 years of climate negotiations, there was a health day, It took us 28 years to realize, climate change is a health issue. Now there's a health day. Around 100 countries made a commitment to build national climate resilient and low carbon health systems, the WHO established what we now call ATTACH, the Alliance for Transformative Action for Climate and Health. So around 100 countries attached to ATTACH. And now many countries are asking, how can we embed environmental sustainability and climate resilience in health planning, in health programming? And that's why this session is very important. This morning I listened to my professor, Uli Norheim, and he was asking us to include or embed equity in the cost effectiveness calculations as we do our HTA. Now we must ask the question as well, how can we incorporate environmental considerations into, CEA, into HTA, into our decision-making and priority setting in health? Early this week, I was in Geneva at the inaugural meeting of the WHO Technical Advisory Group on ethics of climate and health. And these are the same questions that we've been asking. The tension between our health goals and planetary considerations, the tension between our urgent needs today and making sure that future generations also have a livable planet to experience when it's their time, when their turn comes to live in this planet. So these are really hard questions, and hopefully, and this is not to add more pressure to our amazing panel this afternoon, hopefully we'll be able to at least unpack some of these questions, come up with initial solutions, but certainly this is just the beginning of a bigger conversation within our society. So now, let me call on our first presenter, and he is the Dean of the School of Public Health here at Mahidol University. He has a PhD in atmospheric science, so we'll be hearing from someone working in the field of, climatology, and what can people from the health sector learn from another discipline, right? Interdisciplinary collaboration and learning. So without further ado, let's give a big round of applause to Dr. Sarawut Thepanondh.
Thank you very much, Renzo, for your introduction, and good afternoon, everyone. Thanks for having me here. And thanks also to having the environmental session in this HITAP conference. Well, it's the first time that I think we will try to incorporate the environment together with the health issue. And before I start my talk, I just want you to look at my clothes, because this is the theme of my talk. It's the synergistic between environment, climate, and health. Okay, you know that in Thailand is a tropical country, and we encourage people to have energy saving policy. We want everyone to do like 25 degrees, setting the air condition, but come on, it's so hot. No one wants to do it. So in my faculty, public health, we do it like this, 26 degrees. But we allow everyone in the faculty to come with this. Okay, with this, you can be comfortable with that 26 degree campaign. At the same time, for the clothes and for the shoe, it's the upcycling material. So you use the recycle concept. But what we do is, because we don't just only making a campaign, we are the academic institute. So what we do is we calculate together with what we do. We calculate the carbon reduction. We calculate for the air pollutant emission reduction from our campaign and show to the government. And every time when the government body come to my faculty, we ask them to do it the same. Last week, actually, we have the Minister of Environment, the Natural Resources and Environment come to my faculty. I asked him to do the same with me. Okay, so do it like this. That's the way we synergize the climate change, environment, and health together. At the same time, it's more health benefit, right? So this is what I'm going to talk on this. So I'm going to talk on the integration of the environment, the health, and climate change for a sustainable future. Let's take a look at the current global scenario. We found that, with the limited of the natural resources, we already have the environmental degradation with the pollutants that we already emit, and it may be more than the capability of the world that can accept it. And we also have the problem with the health disparities, and of course we do have the problem with the climate change. This is the current global situation. Now looking back to what we work on it. Well, people know that previously we working in a silo. We working in our bubble. And we know that with the silo, we just only concentrate on one's own work and ignore others. The responsible way to do what you are paid to do, and also lack of cooperation, become institution and the organization function poorly and ineffectively. And if people are unhappy, then they have to escalate their concern and be considered that it's difficult for doing so. And we don't want this problem to happen anymore. So that's why the word integration coming. So we try to unlock this transformation solution by trying to adopt a more integrated approach to ensure a healthier work and activity that we can do together. I give you some example. Okay, I just come back from Oxford University. We're going to have a big project on linking the climate change, pollution, and health. And we try to work together with the industrial sector because the industrial sector is the most polluted area, emitter source in Thailand, in some pollutants. Okay, and it may be a bit easier, the most easier part to do with the industrial sector. So we kick off with the industrial sector first. So we try to come up with this kind of causation approach. With the shift of ambient air temperature and precipitation pattern, then we know that it leads to more frequent drought and flood in many areas. And it disrupts the natural habitat. And it affects to the health because it compromises the availability of the clean water and the food security. Then it comes to the problem with the increasing of the risk of the nutrition deficiency and waterborne disease. So you can see that this is the climate change, environment, and health that link together. Okay, and I give you more example. In case of Bangkok, you may know that because yesterday I was in one of the oral presentation room and we're talking about air pollution problem in some city. In Bangkok also we face a big problem with PM 2.5, the fine particulate in Bangkok. But people when talking about the pollutants, they just only concern on the emitter. But in Bangkok, it not come from the emission source. It's come from the problem of the climate change, because of the stagnation of the air, very, very low wind speed that we never have before. Right now, it's very, very low wind speed. So with that very low wind speed, the dilution ability of the air is decreased. So how to solve with this problem? You have to go to where is that climate change problem come from. Not just only reduce the emission of from the emitter. So we move to the integration strategy for a resilient future. I give also this example. The first one that we try to do is to implement what we call the green urban development by design the urban area that holds significant potential for promoting both environment and the public health. So what we can do, well, we can come up with a kind of the green infrastructure. I think mostly of the metropolitan area and urban area, they try to implement this. They try to increase the park area. They try to have the green roof. They also try to, if possible, have more vertical gardens. I show you the benefit of this green infrastructure. We know that, well, this green infrastructure, it enhances the urban biodiversity and aesthetic. I work with the, what we call the Dow Jones Sustainable Index and the Morgan Stanley Sustainable Index in the stock market, because we want to make the economics to encourage people to come up with better environment and protecting the environment. And with this biodiversity index, it can increase a lot of your sustainable index in your stock market. So many of the entrepreneurs, they try to come up with this kind of analysis of biodiversity. And of course, with this green infrastructure, we can mitigate the air pollution and reduce the urban heat island, like Renzo just mentioned, that the heat island is become popular again. This word is more than 10 years, but it's become popular again this year because we found big problem with the hot weather in many cities. And it also leads to the improved public health outcome. I give you some data on the green roof, for example, for its application. We found that the global green roof market size was value about $1.1 billion in 2019. And it is expected to grow about 17% from now until 2027. So 17% of growing up, okay? And I quite like what US do. In New York, in 2029, the New York Department of Building, they already announced that all the new building and the existing one, that going to have a new a big renovation, they have to come up with a kind of that, solar roof or the living roof system, or a combination of both. So that's the way New York City adapt with the climate change and also try to improve the environment. And at the end, it will also improving the health. The other example is from Germany. They have the study to analyze for the performance of 1 square meter of extensive green roof. Okay, and in the slide you can see that if you have 1 square meter of green roof, it can reduce temperature by about 1.5 degrees Celsius. It can save the water about 30 liters. It can reduce the evaporation rate of the water about 2 liters per day. And of course, if you talk about climate change, it can also reduce CO2 by 800 grams. So come up with this kind of data and show it. That's the way we do. Okay. Also for the green roof in Germany, I show you we have a big room to develop it. About 91% of the area is still available to do. Only 9% that already equipped with that kind of green roof. And this is in case of the developed country. What about in developing country? Right, I think this number may be a bit bigger, so that's a way for us to improve. And beyond the vertical guidance, we know for many years that vertical guidance is good, but it will be even good if we move it to the vertical farming. Change our vertical guidance to the thing that we can eat, okay? And with that thing, it will be like co-benefit of both environment and the health. So it's less water, it's less land, and remove the need for the long transportation or production. People who are working on the carbon reduction, carbon emission, we know that the transportation section is the most contributor to the carbon dioxide emission in the world. Okay, so if we can remove that, if we can reduce the transportation, it will be good, and don't use the pesticide also. I'm not going to touch on the circular economy, but I would happy if anyone would like to ask on this, because it's a big controversial issue in Thailand, and we're going to revisit this circular economy this year. Of course, we can move on to the eco-health and One Health approach. And also, we're talking about the sustainable agricultural practice. This new word, the permaculture, I would like to touch on this. The permaculture is a philosophy of working with rather than against the nature. So you do it according to what you have in your hand. Okay, that's the environmental fit and also the health concern. And the disaster preparedness and enhance the resilience by strengthening the healthcare infrastructure. That's the way you adapt with the climate change and environment. Developing the robust early warning system and the training of people is the thing that also crucial. At the end, the policy integration and multi-sector collaboration, I would like to say that, well, we can do it in terms of like strong governmental commitment at all levels. And also it needs the support by the evidence-based practice. It needs to be intersectoral and also aligned with economic incentive. This is very, very important. Okay, that's the end of what I want to say because the time is already over. So thank you very much for your listening. I'm very happy to be here. Thank you.
Thank you very much, Dr. Sarawut, for providing us with a Climate and Health 101. He also presented some of the emerging approaches, lenses by which or through which these interconnected issues are being addressed. You've heard circular economy, One Health. As you've heard, planetary health is the program that I'm developing in NUS. So, later on we can have a discussion. How can these new frameworks be incorporated into our work in priority setting in HTA and beyond? Now let's have our second speaker, who is a lecturer at the Environmental Research Institute, also here based at the Chulalangkorn University, Thailand. Let's give it up for Dr. Suthirat Kittipongvises.
Good afternoon, ladies and gentlemen. Nice to meet you all here today. I'm Associate Professor Dr. Suthirat from Chulalangkorn University, and I'm pleased to be here to join Priorities Conference 2024. And the topic of my talk today is about rethinking climate goal and sustainability, a case of Thailand. And within 10-minute talk, I will give you some of the key findings of one project that we work closely with HITAP team and also with Chulalangkorn University that we working about the quantification of greenhouse gases emission in healthcare facility in Thailand. And the last part, I will give some overview about rethinking again, climate goal and environmental sustainability. First of all, I would like to give you this climate list that I got this information from German Watch that report about the countries that seems to be suffer from the extreme event during the past 20 years back. And you can see the map and also the table here. There are many Southeast Asia countries has been listed in the top 10 countries, including Philippines and also Myanmar, and we are listed in number 9 as they are countries that seems to suffer about the climate risk during the past 19 years, 2000 to 2019. And this is the case of Thailand. Probably you can see about the heavy flooding, negative impacts of heavy flooding to the Thai hospital in many areas of Thailand. And the nation, they also report that Thai hospital at risk of the shutdown due to the extreme climate event. Yeah, this is some kind like the way calling for action for the hospital in Thailand. Apart from that, I would like to touch a little bit more about the climate mitigation. So our country, we set up for the intention during COP26, and we set up for 2 climate goals. First is about the carbon neutrality by 2050. 2050, yes, all right. And for the second is about net zero greenhouse gas emission by 2065. This is some kind like the country climate goal. And based on this goal, I think this is call for action for the health sector in Thailand as well. And this is the reason that we work closely supported by HITAP, that we try to study about the way to quantify the emission of greenhouse gases from the health facility in Thailand. And due to limitation of time, we can select just 10 hospitals in Thailand. And you can see the location of hospital, not just relocated in Bangkok, but case studies out of Bangkok also were selected as case study in our research. Yeah, we put here some photo of data collection, including the case study in the primary, secondary, and tertiary healthcare facility in Thailand. Yeah, this is some ongoing project of our university with the HITAP. And yeah, I can give you quickly how we define greenhouse gases emission in our study, that we try our best to focus about the scope number 1, direct emission from the stationary energy consumption, the consumption of fuel by vehicle. And for the second scope, we estimate emission from the purchased electricity. But anyway, the scope number 3 is very, very difficult for our country because we could not get the whole information at the hospital level. Once we asked them about the availability of information, we could not gain 100%. Once we compare about like some study in the Western USA or in UK, we could not gain the 100% for scope number 3. And last but not least, our project also did the survey that we would like to understand about the emission profile from the staff and also the patient commute. This is some highlight the our activities. Yeah, and we try our best to publish our result, but it's not yet Anyway, we can give you some key findings. For the first, in a sense of the emission intensity, we found that tertiary healthcare level release the largest share of GHG emission in a sense of the emission intensity. Yeah, we divided by the number of patients already. Tertiary healthcare released the largest one. And once we consider about the activities, we found that patient transportation emit the largest share of the emission in our 10 hospitals, followed by the electricity consumption. Apart from this research, we suggest the further study to focus about the emission from supply chain, from procurement, and other activities defined by scope number 3, even as the cost-benefit analysis of low carbon measure should be more considered in the future. I think that's it for the key finding about our ongoing project. For 4 minutes left, I will give you some ongoing about the responsibility or the how our Thai health sector deal with climate change. I can pick you up quickly about some ongoing, and we can share you, sorry I put this one in Thai, together with the English version in this guideline. And we can say that in past few years, 2000 or 2022, the Kingdom of Thailand tried to initiate or empower climate action in our country. First is about the project that we call Green and Clean Hospital. And for the second, this is this guideline we call as the Low Carbon Resilient Smart Healthcare. And in this report, I quickly look about the key information that they share in the public website. They suggest some kind like the key measure that Thai hospitals should implement to reach to the low carbon society, including appropriate treatment technology, low carbon building design, green energy investment, sustainable waste management, low carbon and green procurement, and the last one is about the climate resilient healthcare. Yeah, this is some kind of like idea that our government they sent to Thai hospital. Next is about the green and clean activities. I got this report from the Department of Health of Thailand, and you can see at the corner, you can see the logo of WHO. This is some kind like the collaboration. They also mention about the stories of the green and clean hospital in Thailand. Because I have no time left, anyway, green here, maybe we emphasize about waste. Here is about garbage. Restroom, energy, environment, and nutrition. This is stand for green. And for the second half is about clean. Based on this green activity, our Thai society, they focus about the good communication platform, good leadership, effectiveness, green activities, and also network. Yeah, this is something that they put together as green and clean. Anyway, I have 2 minutes left. I have to wrap up my talk. Not just only mitigation, for adaptation, you can see quickly. This is the adaptation plan of Thailand. This is Health National Adaptation Plan that our country also open for adaptation plan as well for climate change action. Yeah, just 1 minute left. This is my conclusion. Once we are talking challenges, I put some figure that I got from WHO. They mentioned about both low carbon pathway and also the climate resilience for health sector. Anyway, there are too many challenges for Thai society, especially for the health financing and even climate change action plan. Here, I doesn't focus as mitigation, but I'm thinking about both adaptation and mitigation should be the some kind like the good pathway for the healthcare sector. And the most important thing is about the climate literacy for the community and also the whole stakeholders in here. This is very important. And yeah, this is some kind like, last slide for sure, some kind like key recommendation for stakeholders in Thailand that we have to close the gap as much as possible we can do, especially for the capacity building in a sense of financial, leadership, human resources, and also, yeah, I think regulatory is one of the most important because some hospital, they are talking with me that they don't have the clear direction enough for their own policymaker. Last but not least for sure, about climate change action, without active engagement from community and also stakeholders, I think climate change action is never happen. Yeah, that's it, my presentation today. Thank you.
Thank you very much, Suthirat, for sharing the Thai experience. It's great to hear that HITAP is already engaging with this issue. And she also showed some of the emerging frameworks. You know, I'm sure everybody is aware of the 6 building blocks of the health system. And as you can see, WHO actually added the climate lens to the 6 building blocks. So I'll encourage everybody to take a look at that. And certainly, there's something that needs to be done when it comes to incorporating climate into governance and financing, which is priority setting in health is all about. So thank you, Suthirat. Now, we've heard some examples, issues from Thailand, which is our host country for this convening. But we also want to hear what's happening in other countries, specifically here in this part of the world. So we are very grateful that we have with us today the Executive Director of Healthcare Without Harm Asia, which is an international NGO. The Asia office is based in my home country, the Philippines. Please welcome my dear friend and colleague, Ramon San Pascual.
Thank you, Renzo, and thank you, dear colleagues, those who went ahead of me in the panel. I just want to provide more substance on how healthcare is being mobilized to transform itself to become more resilient and as well as low carbon, and go along the transformation of the entire society towards net zero. Now, thank you, Renzo, for mentioning Healthcare Without Harm. It is an international NGO. I lead our Asia office, but we have our offices in Europe, in Latin America, in the US, and in Canada, and we have strategic partners in South Africa, in Brazil, and all other big countries of the world. And the whole point of this building up a huge network is really to recognize that pushing for public health will never be thorough and complete unless one recognizes the environmental health impact of how hospitals do operate. So that is the very mission of our work, really on climate and health and environment. And this is being done through the Global Green and Healthy Hospitals Network, which is a worldwide community of hospitals. In Southeast Asia, we're managing about 12 countries having members of the GGHH. If you look into the map, this is how widespread it is, and you will see there how we are doing it in Asia. In Thailand, we have at least 5 member hospitals, and some of them are already doing net zero work, not only in terms of greening the healthcare, but they're carbonizing their healthcare facilities. Now, in as much as we've been doing organizing healthcare facilities, institutions, hospitals, ministries of health, it is in 2019 that we came out with this report on the healthcare carbon footprint that identifies that if it is a country, the healthcare sector will be the 5th largest emitter in the world. It is a big contribution and, in a way, harsh contribution of the healthcare sector whose mission is healing, and yet in many ways we're doing harm, both to our climate and to our environment. 2 years after, 2021-2022, we came up with another study and report that is how to provide the roadmap to the healthcare sector to go along net zero, along the UNFCCC target 2050 and onward. And here there are seven high-impact actions that were pinpointed in the research. One is that we need to transform the entire healthcare sector towards renewable energy. There's no other way. There's no compromise even. If we really want to provide healing both to our people and to our planet, we must shift away from coal-based energy and fossil fuel towards renewables. And hospitals should be leading this because we are a heavy user of energy. But if you go into the 7, for example, establish greater health system effectiveness, meaning if people are able to live well and promote good health in their families, in their communities, there's no need for people to go to hospitals. And therefore, that huge emission that is taken right away. A sick society would also mean a sick planet. And that's the burden of the hospitals. Now, the other way of working on it is to really align ourselves with the UNFCCC, the World Health Organization, on 2 areas to mobilize healthcare sector, including ministries of health, including small clinics, big hospitals, health organizations, associations of doctors and nurses. And these areas are one on pushing for climate-resilient health systems. The threat of climate is such that hospitals are being flooded, hospitals also run out of water, hospitals do suffer from lack of electricity, and all these are part of building up resilience. However, that cannot be detached from the commitment area 2, where there is this collaboration between World Health Organization, UNFCCC, and as an international NGO, we are tapped to facilitate both areas, and the commitment to is sustainable low-carbon health systems. Meaning, if we are the 5th largest emitter in the world, every hospital, therefore, should be responsible to acknowledge their own harmful contribution to the degrading climate and be able to mitigate its own operations and reduce its carbon footprint. And since 2021, we already developed the Climate Impact Checkup Tool. This is a way for hospitals, an online system, not only to baseline their own emissions, whether Scope 1, Scope 2, and Scope 3, but as well as to plot out reduction annually towards their own set of goals, but hopefully net zero emission by 2050 for the entire healthcare sector. Now, the tool both has that relevance in terms of the addressing global emission, but also working as a sector, and as well as having access to particular hospitals that would want to make use of this tool. Okay, enough for that. In the next few minutes, I just want to showcase to you how hospitals, medical doctors, nurses, and other health professionals are being mobilized along this vision of low carbon and resilient healthcare. There is this such thing as Southeast Asia Alliance for Health and Climate. This is now individual network of medical professionals across hospital. It can be a doctor, it can be a nurse, it can be a laboratory person, but all acknowledging that their work in healing people must be related to healing the planet. How it is being expressed, there is this Kebumi project, which is now a 2-year project in Indonesia. It aims to build an empowered alliance of health professionals, advocating and championing issues of climate justice, health equity, but particularly air pollution is one issue that across our region is relevant and related to our health impact happening because of the climate change. The other is the Health Alliance for Climate and Clean Air Philippines, or HITAP. This is recently formed, but it is It comes out of the many years of work among different institutions such as Philippine College of Chest Physicians, Philippine Society of Allergy, Asthma, and Immunology, the Lung Center of the Philippines, and us providing the Secretariat work as the Healthcare Without Harm. Now, we've been coming out with different policy statements. One recently on Breathing for a Brighter Tomorrow, as an example, pushing and providing pressure to our policymakers to increase the standards on air quality. And then the other area of our work is on plastics, recognizing that plastics is a climate issue. We just participated on the 4th round of negotiation for a plastic treaty in Ottawa, in Canada, 2 weeks ago. And we're mobilizing doctors, we're training them in communications, and we're providing the different resources, including how to do waste audit in the hospitals and how to understand why hospitals should not seek any exemption from decreasing plastic production and as well as decreasing single-use plastic waste. We've been doing audit in hospitals, making them self-realize that the action must come from the hospital themselves and the staff. And we have issued this top 10 prescription even before the pandemic. We've been doing waste audit even during the time of COVID in hospitals, in the front line of the pandemic treatment. And we've been releasing several findings, both pre-pandemic and during pandemic, on how to address plastics in medical setting. Because indeed, plastic is a climate change issue in a bottle. I just captured this from one headline just last night, seeing it, after the summarizing what has happened in Ottawa, 4th round of negotiation for global plastic treaty. Now, in the end, what we are saying here is that we should not only be able to understand, but a healthcare sector, we should be able to deliver climate action, both in terms of providing resilience to our facilities, but as well as reducing the climate emission that is harming people, bringing back patients to the healthcare system. Thank you so much.
Thank you so much, Mon, for that very engaging presentation. You showed to us that there's a lot of energy within this region, in the different countries in this region, when it comes to the issue of climate change and health, but also when it comes to plastics in healthcare. We also learned that there's so many different tools, climate checkup, impact tool, the Global Green and Healthy Hospitals framework. So we're not starting from scratch when it comes to truly embedding climate change, environmental sustainability into healthcare. Now, before I call on our last presenter, I just want to remind you all that shortly we'll have the open forum, and I'm already observing the app. I can see that there are a few questions. Please keep the questions coming, but also I want to make sure that this is a true conversation. You're part of the panel. You're part of this, session, and I will allow one or two people to use the microphone to ask questions or to even, share their experiences when it comes to this pressing challenge of climate and health. We would love to hear from you later. So just be ready with your questions and even your comments. Make sure they're short and sweet. So now, let's have our last but not the least panelist. He is a health economist from HITAP. Please welcome Mr. Sarin Casey.
Good afternoon, everyone. Sawadee Khat. Thank you, Renzo, and the experts in this panel for letting me be part of this discussion. Really appreciate it. So my name is Sarin Casey. I am from the Environmental Economics Unit, or we like to call ourselves E squared U. Not E equals MC squared, but E2U, and we're from HITAP. Okay, so the topic of my discussion is going to be about how can we bring health technology assessment and environmental and climate science into one place. So there's three things that I would like to share on behalf of my team. Why is a health technology assessment research organization interested in this topic? Second, what are we trying to do? What are we doing right now to address this issue? And third, what can we do in the future as a health technology assessment organization? Okay, so before I say why, I would like to ask a question to the audience. Just to see, it's after lunch. We had a lovely lunch, and so people are not sleeping. There was a key information shared by Ramon from this report, from Healthcare Without Harm. If healthcare were a country, it would be the X largest emitter of greenhouse gases. Okay, Dr. Sudhanshu, great. A round of applause for Dr. Sudhanshu for getting the right answer. Indeed, it is the 5th largest emitter of greenhouse gases, and it's quite big and quite worrisome. And as Renzo mentioned earlier at the start, we're not only getting affected by climate and environment, but we're also affecting it. And this is precisely why we are interested in this topic. And that requires a health sector response. And us being a health technology assessment agency, we also want to respond to this call. Again, as Ramon mentioned in his slide earlier, in the last COP26 meeting, there were 2 commitments made by over 80 countries and health ministries in that meeting. The first commitment was to ensure that our health systems is climate resilient, right? And the second commitment was to ensure that our health systems are carbon resilient. HITAP's focus, although we also recognize the first commitment is very important, and we know the evidence, the research is well established, so we do want to continue doing that to stand on the shoulders of giants. But the second part is more interesting, and we think HITAP's comparative advantage can be brought into, especially when we think about the contribution of health system and quantifying that into economic evidence. So one of the requirement was, from this commitment, was to do a baseline assessment of greenhouse gases from health system. And as Ajahn Suthirat from Chulalangkorn University mentioned, that the study is already ongoing in Thailand. We do have some preliminary results, but that is not enough, right? So the health sector response, and we're here to go along that ride. And HITAP recognizes it, and therefore it is a big part of what we're going to do in the future. So second, so what are we doing? So we define the problem, we are aware of the problem, we want to solve the problem. So what are we doing right now? First is the baseline assessment that Ajahn Suthirat mentioned that HITAP in Chulalangkorn is doing right now. And one of the key findings that she shared is that patient travel is the largest contributor of greenhouse gases from the Thai health sector. And that's quite worrying, right? So what are we going to do about this? We start with the baseline assessment. We recognize that's not enough. That is a foundational evidence, but that's not enough. So what our team and our team here in the panel, we're trying to work towards is create a routine generation and collection of emission data at health facilities. Actually, not only just health facilities, but Ajahn Suthirat mentioned that we want to track the entire life cycle of manufacturing process of how drugs are developed and how they're contributing to carbon emission in the country. So that is something that we're working towards. The second is a direct response to the findings from Ajahn Suthirat and our study that patient travel is the largest contributor of greenhouse gas emission in Thailand. So we're trying to see if we can reduce that travel, right? And using telemedicine, which reduces that travel significantly, and trying to see if that actually benefits both the patients as well as the environment. Lastly, yesterday there was a lot of interesting ideas and projects shared by how AI is being used in health interventions. Our team, they're very creative, and they also want to use AI. And they're trying to think about how we can use AI to optimize drug delivery. Again, this delivery, transportation, which our panelists have echoed that it's contributing one of the biggest greenhouse gases in the country, but also in the world. So how can we use AI to optimize the drug delivery so that it's not only efficient in terms of financial resources, but also environmentally sustainable? So these are some of the things that we're doing right now. Unfortunately, I don't have the results, but we'll be really happy to speak with anyone who's interested in these kind of projects and work together. So what can we do in the future as a health technology assessment agency? So I think this was shared yesterday, this morning as well. As a health economist, when we talk about value for money, we look at two things: incremental costs and incremental benefits of any intervention. And now we're thinking of adding this extra component of carbon emission in any of the health intervention that is implemented in Thailand, but also in the global arena. And we hopefully think that this allows us to make more informed decision, not only about costs, health benefit, equity that we discussed in the morning, but also about environmental friendliness. This is a snapshot of the emission that is produced through the entire pharmaceutical supply chain, starting from R&D all the way to disposal. And the contribution is quite large. So you can imagine, so let's imagine that this is a drug, right? Drug X, and we call this comparator. And this drug is being produced using traditional practices that is not eco-friendly, let's say. Now let's imagine another drug, which is what we call intervention in health economics, or HTA. And we say that this drug is being produced using more eco-friendly practices. Now what can we do with this two information? We plot the ICER, cost-effectiveness ICER plane. On the y-axis, we have the cost-effectiveness. On the x-axis, maybe we have the eco-friendliness. As I said, let's imagine this is not established, this is just a game, and we're allowed to think. And because this drug, the comparator, is not being produced using eco-friendly measures, right? It could be cost-effective, but maybe it's not eco-friendly. Whereas this new drug, it can be cost-effective, but also eco-friendly. So which drug would you choose? If you were a decision maker, the one on the left or one on the right? You can just shout. If you had to prioritize. Right? Yeah. So we are hoping this is the kind of decisions and information that health technology assessment can bring into the environmental and climate science and help decision makers make clear decisions. So, but this is assuming that there is a clear trade-off between cost-effectiveness and eco-friendliness, right? We don't know that. Maybe there is, maybe there isn't, and we need to establish this methodology and also the evidence. And I'm really happy to say that the DCA community, so I'm also part of the DCA community, and we were discussing and really happy to see that they're sharing already information about inequality aversion for climate policy. We talked about inequality aversion for healthcare in the morning, but there's also climate policy, and can we use this information to make this trade-off between cost-effectiveness and eco-friendliness? We don't know, right? This is something we need to find out. I will skip this in the interest of time. Yesterday, we also talked about early HTA, and we talked about mitigation. If the drugs are already in the market, there's nothing much we can do. The carbon emissions are already out there. But can we use the concept of early HTA to inform R&D so that carbon emission becomes a key parameter in developing these drugs? So we're trying to solve the problem early on rather than trying to solve when the problem's already had an impact. So we know where we want to go, which is this net zero, right? That's our goal. This is us. We do have some tools, as our experts have mentioned earlier, but in the field of HTA and environment and climate, there are many questions that need to be solved. In particular, do we count the emissions under cost or effects or both? That's a question that we haven't answered, and that is something that the research committee needs to answer. What do we do about the intergenerational impact of environment and climate, right? Right now, in health economics, the time horizon is maybe 10 years, 50 years until you die, or maybe, right? So there's variation, but what in climate and environment, is that enough? Do we need to think about children, grandchildren, and generations to come? How does that affect the discount rate, right? That is something that we need to establish. Do we need to classify interventions? Do we treat vaccines and medicines as the same, or do we need to treat them differently? Digital interventions, should they be under different classification? And again, like mentioned earlier, is there a trade-off? If there is, then do we need to define those trade-offs, right? And whose perspective do we use? So there is some crisis, especially in the methods part for HTA and environment, but crisis always brings opportunities, and this is what the researchers have been doing. The discussion is already underway, especially on incorporating HTA and environmental effects. So with that, I would like to close and say thank you for listening to us. This is our very small team, but we're very eager and very happy to collaborate with everyone. So thank you, Khopun Khap.
Thank you very much. And thanks, Sarin, for that presentation. He's a panelist who's supposed to answer questions, but instead he gave us more questions to ponder about. And I think that just highlights the importance, the newness of this, I would say, subfield in this community of priority setting in health. It's also a subfield, a new subfield for us who are working in climate and health. And I think all the speakers highlighted the importance of coming together, bridging different disciplines and sectors. So I hope that in a future conference, we'll see the priority setting folks and the climate and health folks in the same room, right? And having more advanced discussions, but also hopefully some answers to the important questions that were asked, not only by Sarin, but by many of our panelists. I mean, now, we have around 15 minutes, and I hope that there are questions both from the app, but also from the room. Again, if you really want to verbalize your question or add some few thoughts to our very rich conversation so far, please proceed to the microphone. So I'll be able to see you right away. There's one question from Martin Igerman, who actually, I think yesterday also shared a bit about what's happening in Erasmus. You know, the calculations of the carbon footprint of the medical center, the baseline calculations. He has a question, and I think you already touched on this, Sarin. How can we incorporate, or what can HTA do to reduce emissions? The carbon footprint of a single intervention is probably very small and not changing the ICER. So do you have some initial thoughts on that?
Disclaimer again, I'm not a climate and environment expert, right? So please take it with a pinch of salt. As we showed earlier, you can include the carbon emission either in the costs or effects. And as you rightly pointed out, the costs for some might not be very high, and that might not affect the ICER very much. Alternatively, you can try to look at, if the costs are not very high, you can look at the other dimension, which is the effects, right? What's the health effects of the carbon emission as a result of drug production, right? So that could be your second thing. But if the impact is simply not great, then that's it, right? If that's the evidence, then that's it. But maybe for other categories of drugs, the impact may be higher, and the ICER might be very high. I hope that answers.
To the other panelists, let me know if you have additional. Sure, Mon.
Yeah, the way really to do it is to look at it at the system level, and that is the very reason why, in terms of prioritizing countries, healthcare without harm, choose those who are already into the attach, as you mentioned, the alliance, which means the ministries of health of these 100+ countries already made commitment, both to resilience and decarbonization of their country healthcare system. What we would do is to work with this MOH, like in Indonesia, in Vietnam, in Laos, in the Philippines, and whether it's by training or whether it's by emission assessment, we will help in whatever way, if only to facilitate that massive change that has to happen at the country level, but also to be exemplified by those that I mentioned, doing their own training on emission, hospital per hospital, if only to model how is it to operate as a low-carbon healthcare facility. So there are two ways of doing it, at the top and from the ground, and meet them up. So policy making at the MOH level, and then the actions coming up from the healthcare leaders at the hospital level.
So actually, Mon, I was also contemplating on that issue, and incorporating it in the calculations is one. But I think it's really a multi-level process, and there are many opportunities across levels for incorporating environmental sustainability. It can be an additional criteria. It can inform procurement or bidding processes, right? Especially if a particular intervention has many suppliers, then maybe let's get those products from those companies, manufacturers that abide by green sustainability practices. But also we can look at the packaging of the products, not only the device or the pharmaceutical. And of course the infrastructure where these products are going to be delivered to the patients, right? You can have, it's one thing to look at the product level, but if you are introducing that, let's say, product through a hospital that is so carbon intensive because of the electricity use, because of the bad building design, then it might even negate the low carbon intensity of the product when the environment in which it's being utilized is high in carbon, right? It emits a lot of carbon. So we shouldn't see it as, okay, let's just do it at the level of the ICER. But it has to be a multi-level and even stakeholder kind of approach. Now I'm starting to think, because we're only talking about healthcare interventions and how we apply a climate lens. Professor or Dr. Sarawut, you showed to us some climate solutions that are outside of the health sector, right? Cool roofs, green urban design, right? Are these things, or should these things be part of the business of, let's say, something like HITAP, right? Or an HTA body? I guess this is also connected to some of the questions in the app. Two questions at least ask, how can we encourage more intersectoral collaboration, right, in this kind of work? How can we, bring in more disciplines? But also, how can we look at, again, all these other interventions that are less thought of as healthcare interventions? Maybe you have some thoughts.
Yeah, thank you. Actually, I also have this problem because when I'm working with the Thai government, I also work with the House of Representatives in Thailand, and when we try to encourage the trial implementation to a better world using the climate change, sometimes it's a bit difficult because we are a developing country. So what we try to do is we have to make sure that with that kind of global effort, it also have the local impact, the benefit to local impact. So together with this, we always show together with the CO2 data, the air pollutants data, the water pollution data, together with that climate change data, to make sure that once you do this, once you implement this kind of activity, it also have the local benefit because that the developing country want to have, and show it in terms of the data, okay? And of course, the way to encourage them to do is try to come with the economic analysis, showing them that, well, they have the monetary benefit by doing that. And I would like to tell you, can we just go back to the previous question? One of the problems with the carbon footprint in Thailand, for example, is if you just simply only do the carbon footprint, but you not report it, you not declare it, you not make the public to access to that data, then automatically it not have any competition in reducing, because we want to make sure that it's a kind of voluntary reduction. We don't have the regulatory control of carbon emission. No country have it. But we do it voluntary. So with that voluntary approach, the data need to be visible. So when everyone saw this data, then they voluntarily to reduce their emission. So that may be the next step that we should encourage to do, together with, systematically calculated. Yes.
Thank you. Suthirat, you want to add?
Yes, I want to share some situation in Thai society. Once we are talking about climate change, right now I think we could not wait anymore, right? You can see maybe especially last week, the temperature was about above 40, some day 45, and maybe hotter than 45. Yeah, during the past year, there are too many people come to us in our university. They're calling for action. They're asking for any kind, like the big movement about climate action. What should they do? What kinds of the activities that organization can be done, something like that. So maybe climate change is big issue in the global scale, and yeah, particularly in our high-risk area. And for a question about the intersectoral collaboration, once again, I can share in a few of in Thailand. I think right now we try our best to work together. Probably university, we also open for collaboration. And also the government, we can say that we we try to move quickly about the climate goal. Probably we set up for the COP20 second I mentioned already. So once we are set up for the climate goal, probably this kind of thing is some kind of like blueprint for everyone working for climate action. And last thing, I want to focus about the database in Thailand. Probably for carbon footprint organization and carbon footprint for the products is very important to maybe make the baseline information for.
Right. Mm-hmm. So I guess one homework for us in this room is to look at our country's national adaptation plan and nationally determined contributions when it comes to the reduction of greenhouse gases, because we must make sure that these plans, policies from outside of the health sector are aligned with public health goals. And if there are tensions, right, between these, national plans, created by different government agencies, then we should be able to, marshal our tools and our, skills and our knowledge to address those tensions and those gaps. I promise we will make this an interactive session, and I'm seeing two colleagues in the microphone. I'll call Catherine Littler from WHO first, and then our colleague here. Keep it short and sweet.
Great, thank you. Excellent panel. I'm Catherine Littler from the Health Ethics and Governance Unit. I'm an outsider to this health priority setting. We work on research priority setting, and I also lead the tag that Renzo mentioned. I want to link this morning's panel to this afternoon's panel. So we heard about equity in the talks this afternoon, and we heard this morning that equity is quite well defined in health priority setting. But I want to ask this community, is that definition of equity currently include the human-animal environmental interface? Is my first question for you, because it really needs to if we want to link these initiatives. And if it does, or it doesn't, what's the best approach to doing that? Is it a One Health approach, a planetary health approach? And what are the downsides of each of these approaches? So if you use a One Health approach, you're always going to start with the human center, and you may not actually address some of the underlying health challenges that are exacerbated by humanity. So I'll stop there.
Thank you. So a call to be less anthropocentric, but also thinking not only of intergenerational equity, which I think some of you already alluded to a while ago, but even interspecies equity. So interesting and important and urgent questions. And one question from this other side.
Thank you for the very interesting presentations. I'm sure it opened a perspective to the many of us. So I wanted to ask regarding the health system preparedness for this sort of work. For example, when we were institutionalizing HTA, we actually had to build institutions and capacity to do so. But this sort of work, like addressing the environmental issues, might also require an appetite that whether do we have such advanced technologies that would actually be the better ones. Like, for example, you mentioned for drugs, a better way of producing them, a better sort of equipment to, perform health tests and activities in the hospitals. So what do you think about the investment that is related to that for the advanced technologies that would actually impact the environment? That is one. And the second is around any thoughts on how do we quantify our health impacts? Because any impact that preventing impact on climate would generate can also be maybe again quantified into the impact on the human. For example, air pollution. If you do any intervention on air pollution, it might again improve the quality of life. So how do you think, maybe just your thoughts that how do we quantify these impacts?
And very quickly, your name and affiliation?
Yashika from India, PGI.
Wonderful. Choose just one of the 2 or 3 or 4 questions that were asked. Unfortunately, we have very limited time. But this is just a start of a bigger conversation. Maybe, who wants to start first?
Yeah, actually the One Health approach is one of the best way to kick off of this, because we are already been implemented for quite a long time. But if we want to integrate it, we just simply use the environment and the climate change action. We do it in 2 ways, not just only adaptation, but also the mitigation, right? So we don't just only try to adapt ourselves on the changing world, but we also need to mitigate, because we still have to live on it, right? So use both mitigation and adaptation and include it in the One Health. I think that's the best way.
Yeah, one quick word about the equity, but it's on a higher lens. The whole crisis of climate is also facilitated by the inequitable society. The over-materialist perspective that brought about so much abuse to our planet, of our resources, leading to high-emitting practices in businesses and industries. So we don't want to recreate that inequity the moment we are moving towards low-carbon society or even low-carbon healthcare. We want to make sure that health inequity is addressed along addressing a low-carbon society and low-carbon healthcare system. And I think that if we are able to do, we will be addressing many other portions of inequities taking place all over the world.
Sorry.
Thank you, Renzo. I would like to respond to Yashika's question on capacity. I think it's never too late to jump in this climate and health work. Like HITAP, this is new for us. And yes, similar to HTA, we have to build our capacity from scratch, and that's what we're planning to do internally and then hopefully in the future externally. Second, on investments required to change in practice, yes, that goes without saying. We have to change the way we do things now, and this is for the long-term benefits. You talk about the cost. There's definitely cost, but there's also a large body of evidence showing the return on investment as a result of the change in practice for climate and health benefits. So if we can show that, then it's a good value for money.
I think, Sarin, that's a very, very powerful call to our colleagues, an invitation to be more engaged. As you already noticed, we don't have the time to answer all the questions that were raised. I'm sure there are more questions lingering in your minds. This is just a start of an exploration, an inquiry. As I've said, a new subfield. The frustrating thing about the climate and health nexus is that time is running up, right? I already mentioned we thought we have until 2030, according to Paris Agreement, but scientists are saying the effects are going to manifest sooner than that, and therefore we really need to mobilize, the global health community, including this society, to be part of action, climate action, to improve people's health while at the same time safeguarding our planet for future generations. So I think we'll end there, and I hope that we will continue the conversation along the corridors, and hopefully in a future priorities conference, we will already be presenting some of the answers. And I hope that we've been able to contribute to the safeguarding of our planet as we improve the health of our people. So thank you to our amazing panel. Thank you to all of you. And thank you very much for this opportunity.